Now we talk about dentists just briefly there because there's a whole lot of ideas out there that you shouldn't put mercury in your mouth. And as a general rule, that's true. And most of us probably have had mercury in our mouth at one time or another, because that's just the way it was when most of us grew up. And I'm not. Should you have your mercury taken out? Well, I don't know. That's a huge challenge because some people get worse when they take the mercury out. Some dentists don't know how to take it out effectively, and some people really don't even need to have it taken out. It's a very expensive procedure, and so it's not just an automatic that you've got silver amalgams in your mouth and therefore you better get them out. It's a good idea to have some sort of testing done to see if, number one, you're accumulating it, and number two, you don't want to just put yourself into a crisis by having it taken out and stirring everything up. Then there's a question of, if I've got a bad tooth, do I get a root canal, or do I pull it out, or do I get a implant? That's a huge question, and you know, it's getting a root canal is a very costly procedure these days. You know, you can spend $1,500, $2,000 easily getting a root canal or getting an implant, and that's pretty spendy for a lot of us. Well, I can't answer that question, but it's something you think about. But don't feel just because you have a silver amalgam you have to have it taken out. Okay. Well, the other thing I just want to bring up, because I think this relates to all these things. Why do you think people have crooked teeth? You've noticed there's so many more people now with crooked teeth. Your grandchildren, do you have any grandchildren that don't need braces?
The majority do.
I think the majority do. And do you understand why?
Poor nutrition.
Pardon?
Poor nutrition.
Exactly right. When mom isn't well nourished, and this has been documented mainly by the Price Pottinger Foundation. Did I put that website in there? I hope I did. Maybe I didn't. You've got it. It's on my website, and it's I publish it. I think they're a great organization. But when mother isn't well nourished, then her children, it's not that their teeth are crooked, it's that the head doesn't develop naturally and normally and allow enough room for the teeth to come in the way they're supposed to. It's sort of like you got one closet in your home, but you've got so much stuff you got to put in there. Now, ideally, you have a bigger closet, but if your closet's just small and you have to get everything in there, it's not in very good order, and that's what happened. And unfortunately, most orthodontists don't explain that to people. Like my granddaughter, who went in and has braces, and her teeth look very nice, but her dentist didn't say anything about what she might do to prevent this from happening in her children, and which is sad. But you'll notice, I mean, there's probably 24 orthodontists in Eugene, and they're busy. And now you get Invisalign, and all these people are into this straightening teeth business because it's a huge business. Okay. Now another thing, this is an aside, I didn't really plan on talking about this. There's a therapy called craniosacral therapy. And it's basically where you intuitively move the bones. The head consists of about 40-some bones. And we've all been, at least I was taught in medical school, they didn't even talk about it. This is the skull, basically what it says. And these are the bones of the skull. I think they made us memorize them, but they didn't tell us much about it. But it's very interesting. When a baby's head is born, there are these little cartilaginous plates, and they have a smooth edge on and the baby's head's soft, and as it grows, it gets firmer. By the time they're about 6, the bones have developed serrated edges, and so now the bones are like this, and the bones are interlocked with each other. Now, why do you think it's like that?
Protection?
Well, because it moves.
Oh.
It's a gearbox. And there's actually a rate, a rhythm to the bones of the head. and about 8 times a minute, the bones flex and expand and extend, and with a little practice, you can feel that movement in the bones of the head, and it pumps the fluid from the ventricles down the spinal column and back into the lymph. It's an amazing system. Now, almost every child bumps their head, and sometimes if you bump it just right, you jam the gears, and so that motion is restricted, and so that can create problems with people's health. And sometimes it's headaches, sometimes it's a variety, it could be affect some distant part of the body. One thing we found, one of my children had definitely crooked teeth. I mean, her canine teeth were coming in above the gum line. And so the usual procedure would be to pull out a bunch of teeth and put a bunch of wires on there and force things into place. And you notice that almost every child that gets braces has a retainer, right? And what's the purpose of that retainer? Well, it's to keep the teeth from going back to the position they want to be in because of the pressure from the bones of the head. So you end up wearing this retainer, and everybody loses their retainer. Every child I know has lost their retainer. But anyway, it's because they need the retainer because the cause of the problem hasn't been rectified. It hasn't eliminated. Anyway, I was friends with a dentist in town called Martin Allen. He's a brilliant guy. He's a little bit crazy, but he's brilliant. But he said, okay, let's try some cranial work on your daughter. Now, cranial work is probably the most gentle. You put your hands just sort of near you can touch it very lightly. They describe the touch from cranial therapy as the touch of a silk handkerchief. So you can say it isn't a whole lot, or the weight of a nickel. So it's very, very gentle. But with a little practice, you can learn to feel the motion of the head. And then you plan in your head, you visualize in your head how you want that motion to change to become more normal. Well, after about 2 or 3 months, her teeth were straight.
Amazing.
And she didn't need retainers. And she's now 40, and her teeth are still straight. But you could learn to do cranial therapy. It isn't that difficult. You have to read a little bit. You have to practice a little. Find someone you can practice on. But it's an amazing therapy that doesn't require a lot of skill because there's very little risk. You can Google craniosacral therapy or something like that. But it's you might be fortunate enough to be able to find a dentist, and if you know someone that's willing to consider it. Many people, it's really sad how few people are even willing to consider these strange things.
How long did it take? How many treatments before
It took about 6 or 8 with my daughter.
Like about 2 months?
Every 2 or 3 weeks, we weren't very consistent. He'd call and say, well, I would say, well, when's a good time to bring her over? He'd say, oh, what about next Tuesday? It was just very casual. It was amazing, though. But anyway.
Would those be helpful? Would that be helpful for migraines?
Well, here's the thing. Would it hurt? Now, if you got a cure for your migraines, well, keep at it, unless it's $50 a week medication. But see, if a therapy is very, very, very safe, even if there's only one chance in 50 that it may help, why not try it?
Sure.
Yeah. And the fact that you bring it up suggests that somebody isn't happy with the treatment they're getting for their migraines.
Right. We've got a friend that suffers from migraines.
Yeah.
From a car accident.
From a car accident.
Yeah, well, see, you get a car accident, you get hit in the head. And traditionally we take an x-ray and there's no fractured skull, and maybe you wear a neck brace for a while. But very, very few doctors think about the cranial movement. Most don't know about it. My son's in osteopathic school. Now that's where it came from, the osteopaths. But you'll notice a trend. Well, you may not notice it because you're probably not aware of it. The medical the MDs are sort of taking over. 20, 30 years ago, at least in California, the osteopaths were given the option of becoming MDs, and many of them took it. And now the medical board controls osteopaths and medical doctors now. And the medical school has a program now to integrate chiropractors and naturopaths with the medical school, which basically means that they're not going to be naturopaths anymore. They're going to learn how to prescribe medication. But anyway, my son's in osteopathic school because he's very interested. It's really, I don't know if you know Tom Peterson. He does a lot of osteopathic stuff. It's amazing. It's amazing therapy. But anyway, he says in the school he's attending, they don't teach it. They don't teach osteopathy anymore. And so it's going to be a dying art. And pretty soon we aren't going to have that choice. You're going to get your pain medication, your physical therapy. Maybe the chiropractors will still be doing manipulation, but the medical doctors want to take that over too, because they are aware that more and more people are going to those types of doctors, which means fewer and fewer are going to them. And so if you can't outcompete a business, you try and take it over. Anyway, there are ways to approach crooked teeth that don't if you just think about it, how do they make your teeth straight? Well, they put wires on. Have you ever talked to someone that just had their braces adjusted?
Ouch.
Yeah, it hurts for a while because you're moving those teeth against their will. You know, it just reminds me of some of these games. You build up the tension in something, and you have to be very careful not to let it go because it's just going to explode. Anyway.